Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering pre and perinatal nursing. It's maternity or OB. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. I've got so many resources available there for you. I've got audio lessons if you are in your last semester of the nursing program or you've graduated, you're studying for your board. My new book is out. Nexus Nursing's NCLEX RN cheat sheets. The one for PNVN is coming out soon, so watch out for that. Lots of resources. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Prenatal nursing. First question. Okay, so select all that applies, guys. All right, what are the presumptive signs of pregnancy? Select all that applies. What are the presumptive signs of pregnancy? Here are your options: nausea, vomiting, amenorrhea, breast fullness, urinary frequency, fatigue. Select all that apply. What are the presumptive signs of pregnancy? Nausea, vomiting, amenorrhea, breast fullness, urinary frequency, fatigue. Can you zoom out? The answers are cut off. Let me see if I can zoom. No, it's not. Let me push this back. Is this better? Is this better for you guys? Okay, all of them. All of them. All of these are presumptive signs of pregnancy. What are presumptive signs of pregnancy? Those are signs that, yeah, you might be pregnant. We see this a lot in pregnancy, but doesn't necessarily mean you're pregnant because guess what? We see this in other conditions as well, right? So, nausea and vomiting, yes, we see that a lot in pregnancy, but we see that in a lot of other conditions. Same thing as amenorrhea, not having your menstrual cycle, breast fullness, or sometimes NCLEX will, what will they, what's the other phrase they'll use? Tingling or sensitivity, urinary frequency, fatigue. Let me give you some other presumptive signs of nursing that NCLEX asks about that you need to know. Guys, if you're studying for your boards, please make sure you take notes. If you're not taking notes now, because this is going to be on YouTube, go back and watch it. The code to get in the Kahoot is 819-3452. 819-3452. Matter of fact, can everyone on the live, can you please type the code to get in for latecomers? 819-3452. Type that on the live for me, please. What was I going to say? Oh, yes. So on NCLEX, the other presumptive signs that they do ask about that you need to know, make sure you guys write this down. Quickening, that feeling of the of fetal movement that they may feel quickening. Linea negra, that's the skin changes. And largening of the areola or darker pigmentation of the areola. All of those are presumptive signs of pregnancy plus the screen, okay? All right, next one. At how many weeks should the fundus be located at the xiphoid process? Type in your answer. If you're on the pin, type if you're on the pin. If you're on the Zoom, type in your answer. If the fundus is at the xiphoid process, how many weeks gestation are we looking at? Guys, type your answer on the live. What do you think? If the fundus is located at the xiphoid process, how many weeks? Type in the number. How many weeks gestation should she be in? 7:36, 8:30, 13. You guys were all over the place. 36. Let me see what else you guys said. Hold on. 3:15. Oh, you guys were just guessing. You guys were just guessing. Okay. So the correct answer is 36. You need to know that. Let me ask you guys another question before we move on. Let's say the woman is at 16 weeks gestation. Where would you expect that fundus to be? Do you guys know? You got to know it for boards. At 16 weeks, do you know where? Halfway between the symphysis pubis and the umbilicus. Halfway between the symphysis pubis and the umbilicus. Okay? Now, how many weeks gestation would it be if the fundus is at the umbilicus? How many weeks? If the fundus is at the umbilicus, how many weeks gestation? 20 to 22. Those three things I just asked you about, you need to know it for NCLEX. Don't say I didn't warn you. Select all that applies. Which discomforts of pregnancy are seen more in the first and second trimesters of pregnancy? Select all that apply. Here are your options: nausea and vomiting, heartburn, breast tenderness, ankle edema, urgency and frequency, varicose veins. So, out of all of these clinical signs and symptoms, which ones are seen more in the first and second trimesters of pregnancy? More in the first and second than third. Which ones, guys? If you have not joined us in the Kahoot, you can still participate on the live. Just type in your answer on the live, what you think. Okay, let's talk about this. The discomforts of pregnancy we see more in the first and second is going to be nausea and vomiting, breast tenderness, and urinary urgency and frequency. You see those other options: heartburn, ankle edema, varicose veins. We see those more in the second and third. We see them more later on during the pregnancy, okay? Now, for nausea and vomiting, what are you going to teach your patient? You're going to teach your patient about having small, frequent meals, staying away from fried foods, staying away from fatty foods, not drinking and eating at the same time. Should drink between meals, but not with meals. All of those make a big difference. And also crackers, that helps, right? Sucking on sugarless candy, that can help with the nausea and vomiting. What about breast tenderness? What are you going to teach the patient? You're going to teach the patient to wear supportive bra. You're going to teach the patient when they shower not to put soap on the nipples or the areola because it causes dryness and it can cause irritation, right? What about urinary urgency and frequency? What are you going to teach them? You're going to teach them about staying away from natural diuretics, things that have caffeine in them, like, of course, coffee, tea, stay away from soda. You're going to teach them to, when they go to sleep, instead of sleeping on their back, to sleep on their side so there's not too much pressure on the bladder, right? You're going to teach the woman about Kegel exercises. Professor D, when will this be uploaded on YouTube? I have finals next week and want to use this to help study. It's going to, as soon as this is over, it should be uploaded within 20 minutes of the Kahoot being over. It won't be long. Okay, type in your answer. Chorionic villus testing is performed 10 to blank weeks of gestation. What number is blank? Chorionic villus testing. When is it performed? It's performed between 10 and how many weeks of gestation? Now, while you're thinking of your answer, I'll tell you what it is if you don't know. Chorionic villus testing, it tests for like genetic abnormalities. So actually what they'll do, they'll aspirate a small amount of the tissue to test it for genetic, I don't want to say the word deficiencies, but abnormalities. Okay? What's your job as a nurse? You better make sure that the consent is signed and the consent was informed, right? 10 to what? 13. That's the answer. 10 to 13 weeks gestation, that's when they do it. Your job as a nurse, you better make sure that consent was signed and it was informed. So if they signed the consent, but they signed the consent under duress, they signed the consent after um, any mind altering drugs were given, uh, um, pain meds, anything, it's not informed. And guess what? Guess who explains the procedure? Guess who explains the benefits? Guess who explains the risk? Not you. You're just there to witness. It's the healthcare provider, okay? All right. Type in your answer. Amniocentesis is best performed between 15 and how many weeks of pregnancy? Amniocentesis. 15 and how many weeks of pregnancy? While you're thinking of your answer, and I'll tell you what amniocentesis is. That is where they, with the needle, they'll withdraw fluid from the amniotic sac, and it'll help also check for like genetic abnormalities. Okay? So it's not tissue that's being tested, it's going to be fluid and they'll test the fetal antigens as well. And also they use the amniocentesis to check for fetal lung maturity to see if that fetus will survive outside of the womb. 18, 22, 28, 20. What's the correct answer? 20, guys. You need to know that. Between 15 to 20 weeks of gestation, no earlier than 15. Okay, 15 to 20 weeks. Why that time frame? Because by then there'll be an adequate amount of um, amniotic fluid. Okay. Select all that applies. What are the risks of amniocentesis? So I told you what it is. I told you what they test for. What are the risks? Here are the options. Select all that apply. Infection, premature rupture of membranes, miscarriage, fetal injury, Rh isoimmunization, hemorrhage. What are the risks? The woman's about to get an amniocentesis and the healthcare provider is explaining the risks. What are those risks? Very good, future comedy. Judith, very good. There's more. All of them. And you need to know this, guys. The risk of amniocentesis infection, and that makes sense because, guys, and this is a rule of thumb, not only from maternity, across the board, anything that is invasive, anything that's being introduced to the body, there's going to be a risk of infection, right? And I just told you what an amniocentesis is. Literally, they're taking a needle, right? And they're using that needle to withdraw amniotic fluid. So, of course, there's risk of infection. There's risk of the water breaking, premature rupture of membranes. There's risk of the woman miscarrying. There's risk of that fetus being injured. Rh isoimmunization, absolutely. And let me tell you, that is why whenever an amniocentesis is performed, if that mom is Rh negative, she's getting RhoGAM. Absolutely. And of course, hemorrhage. But there are two other risks that you absolutely must know for testing purposes. The first one is placental abruption. That is a risk that you need to know. There is a risk that the placenta will detach from the uterine wall after that 20 weeks, right? That is a medical emergency. And the second risk, guys, is, oh my gosh, I can't remember the name of it. I'll tell you what the pathology is, but I can't remember the term for it. But another big risk is when the fetus's fetal antigen gets mixed with into the mom's bloodstream. And that is a medical emergency because that can cause cardio um cardiac pulmonic collapse of the mom because her body will literally react to it. Okay? It's called something embolism. I can't remember. Amniotic? I think amniotic embolism. Am I right, guys? Amniotic embolism. I think that's what it's called. I can't remember. But what happens is, like I said, when the fluid and the fetal antigen goes into the mom's bloodstream, and there's a chance of that happening, the mom's body will have a severe reaction to it. Okay? So that's very important. Make sure you guys know that. True or false? A reactive stress test is good. Is this true or is this false? So mom's getting a, a non-stress test, and the result was reactive. Is that a good thing or a bad thing? A reactive non-stress test is good. Is that true or is that false? Something you gotta know about the stress test, it checks, the fetal, heart rate, the fetal well-being, oxygenation. It gives a lot of great information. If the result is reactive, is it a good thing? Yes, it is. Yes, it is. No, Retina, it's true. It absolutely is true. We want a reactive. Reactive is normal. Sometimes it might not be called reactive, it might be called negative. Same thing. It's good. Okay, it's a good thing. If it's reactive, if it's negative, that means it's normal. What does it mean to us if it's reactive, if it's negative, if it's normal? That means we're seeing two or more fetal accelerations of at least 15 beats per minute during that contraction lasting at least 15 seconds of acceleration. Okay? Okay. True or false? The non-stress test is an invasive procedure. Is this true or is this false? The non-stress test is invasive. Is that true or is that false? Oh, you guys are doing awesome on the live. Everyone's getting this right. False. It's not invasive. Type in your answer. A pregnancy that ends before 20 weeks gestation, whether spontaneous or elective, is known as what? And I'll give you a hint. It starts with an A. What is the word we're looking for? A pregnancy that ends before 20 weeks gestation, whether it was spontaneous or elective, this is known as what? Nice try, Jayla. I'll give you A for effort. I like that. You're thinking. Come on, guys. No one knows the answer? I say it starts with an A. How you gonna write premature? Abortion, abrupt, true. Abortion. A pregnancy that ends before 20 weeks gestation, whether it was spontaneous, it was not expected to happen, or it was an elective procedure. Either way, if that pregnancy ends before 20 weeks gestation, this is known as abortion. Okay? All right, select all that applies. What are the risk factors for abortion? Now, remember, guys, abortion can be spontaneous or elective as long as it happens before 20 weeks that pregnancy ends. What are the risk factors for this to happen? Here are your options: history of miscarriage, having Cushing's syndrome, having lupus, smoking, drinking alcohol, having a high caffeine intake. Those are your options. Select all that applies. You guys are doing great on the live. Good. The code to get in is 819-3452. 819-3452. But we're almost done. We only have two more slides to go. All of them, guys. All of these are risk factors for that pregnancy ending before 20 weeks gestation. Some more other risk factors that you absolutely need to be aware of. Having a history of an elective abortion, that places you at risk for abortion. Having uterine abnormalities like fibroids or scar tissue, that places you at risk. Having a high fever, a really bad infection, such as sepsis. Trauma. Imagine you're pregnant and you get in a really bad motor vehicle accident, right? Trauma. PCOS, polycystic ovarian syndrome. All of those are risk factors. Low progesterone. Okay. True or false? A threatened abortion is when the pregnant patient has spotting and cramping with cervical changes. Is this true or is this false? By the way, you guys need to know the difference between a threatened abortion versus a complete abortion versus an incomplete abortion. You guys need to know the difference. But for this particular question, a threatened abortion is when the pregnant patient has spotting and cramping with cervical changes. Is this true or is this false? Thank you, Nancy. Oh my gosh. 45 of you guys said true? Mm-mm. There is one word in this sentence that made it false. And exactly what I did to you, that's what NCLEX does to you. And that's why I preach to you guys all the time. If your answer is not 100% correct, it is false. I don't care how beautiful that answer looks to you. If one thing in that answer is incorrect, the whole thing is wrong. Throw it out. What's wrong with this? Let me read it to you. It says an abortion is when the pregnant patient has spotting and cramping with cervical changes. A threatened abortion is when the pregnant patient has spotting and cramping without cervical changes. That cervix has not thinned, that cervix has not dilated. That one word with, that's what made this incorrect. You guys better stop playing. You better know the difference. Now let's talk about the difference between complete and incomplete abortion. So an incomplete abortion is when a portion of the fetal product has been released, but some of it has been retained. Okay? Complete abortion is when all of it has been released. All of the fetal product has been lost. None of it has been retained. By the way, when it comes to incomplete abortion, which again, remember, some of the fetal product remains in the body, usually it's going to be the placenta. Not always, but usually it's the placenta. Something else you need to know for testing. Risk for postpartum hemorrhage if any piece of that placenta stays within the woman. Okay? Professor D, I just ordered my book now. Can't wait to start reading it. Okay, Chi Chi. All right, true or false? The patient with preeclampsia is given magnesium sulfate to lower the blood pressure. Is this true or is this false? The patient with preeclampsia is given magnesium sulfate to lower the blood pressure. Guys, turn on your notification for me so when I come live, you guys will know. Turn on your notification for Nexus Nursing. You'll be notified every time I do a live with you guys. You guys are about to give me a heart attack. You got to be kidding me. 26 of you said, I'm turning this camera around because you need to look at me in my eyeball. Don't you ever in your life do that. Let me tell you, there are certain things NCLEX has been asking about since I started teaching this stuff in 2006. I don't know about before then, but since 2006, NCLEX has been asking the same question in a million different ways, but they've been asking the same question. Excuse me? Let's get this clear right now. Let me tell you guys something. There are way too many drugs on the market with way less side effects and adverse effects to bring down that blood pressure for us to give that patient magnesium sulfate. You must be crazy. You must be Looney Tunes. Let me tell you this. We give magnesium sulfate to keep that patient that's in preeclampsia from going into eclampsia. That's why we're giving that magnesium sulfate because we don't want them going into seizures. Magnesium sulfate has so many adverse reactions. We're not going to give that unless we absolutely have to. We don't want that patient to have seizures. Now, one of the side effects of magnesium sulfate, because remember, what does magnesium sulfate does? It relaxes smooth muscle. That's how we prevent the patient from having seizures, right? So one of the side effects of magnesium sulfate is lowering the blood pressure. Okay, great. Because the patient with preeclampsia, the blood pressure is high. Great. But that is never an indication for giving magnesium sulfate. If I could wrap my hand around your necks right now and just shake you like this so you never forget, I'll do it. Because I promise you, this is one of the classic questions NCLEX loves to ask about. Do not be fooled. We give magnesium sulfate to prevent seizures, never to lower blood pressure. Does it lower blood pressure? Yes. Are we happy about it? Yes, but we'll never give it to lower blood pressure. Let me ask you this. If we do have to give magnesium sulfate, what are we going to make sure that we have right there available to us? What drug do we have to have right there available to us if we're going to give magnesium sulfate? Come on, quickly. Quickly. Calcium glucate. Thank you. Thank you, Amanda. Calcium gluconate. That's the antidote. You need to know this. All right. Let me stop yelling at you. But seriously, guys, make sure you know that, okay? Okay, excellent. Okay. One more slide. One more slide. You guys are going to give me a heart attack. Select all that applies. What are the signs and symptoms of magnesium toxicity? Now, guys, I already explained to you what it does. What are the signs and symptoms of magnesium toxicity? This drug's working a little bit too well. What are those signs and symptoms? Here are your options. Select all that applies. Flushing, sweating, hypotension, depressed deep tendon reflexes, decreased urine output, CNS depression. If you haven't done so already, turn on your notifications for me so when I'm come on live, you'll be notified. All of them. All of these are signs and symptoms of toxicity that you need to be watching out for. And if you see these signs and symptoms, you're going to stop. Oh, let me turn this back on. You're going to give me a second, guys. You're going to stop that infusion. Also, magnesium sulfate has to be given on a pump. It has to be given on a pump, okay? Shelly says, but it's the blood pressure that causes the seizure, I thought. Shelly, I don't understand. Okay, what are you asking? Yes, that blood pressure being so high can cause the patient to go into seizures. However, we will give that patient antihypertensive drugs, not magnesium sulfate. Magnesium sulfate is given strictly to prevent seizures from happening. We want to relax that mu smooth muscle. Okay, let's see how you guys did. That was our last slide.